Welcome to Charge Passing training for physicians, mid-levels, and clinical staff. Before we start, I'm going to review some key points in regards to charge passing. The first extremely important point is that all charts must be pulled from the appointment schedule in EMR. If a provider attempts to sign off on the chart and it was not pulled from the appointment schedule, a yellow triangle and error message will appear in the sign-off window stating that this encounter cannot be billed electronically. If this happens, the provider must cancel out of the sign-off screen, go back to the appointment schedule, and double-click to pull the encounter from the schedule. The second point is in regards to documenting in the assessment and plan. All orders and procedures that you want to bill for must be ordered in the assessment and plan. All orders and CPT codes must reflect the actual provider or the ordered for provider on the order. The ordered for provider can be edited within each ordered code by right-clicking on the CPT code, selecting Edit, and changing the ordered for field so that it reflects the proper ordered for caregiver. This also may be defaulted to the appointment caregiver under caregiver customizations that we will review at a later time in the training. The final key point is that you must use valid diagnosis codes. All labs and procedures must be linked to a valid diagnosis code, and only system-delivered diagnosis codes should be used. If a SNOMED or a free text code was used, that code will pass to the PM system, but no diagnosis code will pass along with it. An error message will also appear during the sign-off. The billing status will need to be changed, or a different lab procedure with a valid diagnosis code will have to be chosen. There are some new and improved assessment and plan workflows that we're now going to discuss. The first pertains to injectables. As you'll notice, I have a Kenalog injection listed under my assessment and plan. The new screen is called the Medication Administration screen. In order to access that, you can click on the pencil icon and the Medication Administration Procedure Order will appear. Select Ordered For unless the default has been selected to Appointment Caregiver. So you'll notice that my Ordered For and my Notify are both selected to the Appointment Caregiver. When I click on the ellipsis to the right of the medication name, I can then make additional changes to my medication. The lot number, expiration date, and other required information can be entered into this window. Then you can save and complete. It's important to remember that if instead of using 10 milligrams, in this case you did 20, you would need to make sure that you change the units to 2 so that it properly documents that it was 20 milligrams versus 10. And click on OK, and now my medication has been properly updated. The next item that we will discuss is immunizations. Immunizations can now be fully documented from the assessment and plan without having to go to the immunization module. Select the immunization and click on the pencil. The immunization procedure order screen will then appear. Once again, select the ordered for provider as well as the notified provider, and then click the ellipsis to select the proper medication information. The Immunization Record Properties window allows you to enter the lot number and other required information without ever having to leave the assessment and plan. Once all of the required fields have been completed, click on the Save and Complete button, and then you can also click on OK under the Immunization Procedure Order screen.